Hi, I'm Dr. David Hill, and today we're going to be talking about relieving your infant's gas pains. Now, infants cry for a lot of reasons. They might be hungry, wet, might need a diaper change, might need to be held, might need to suck. However, some infants seem to draw their legs up and really seem to be in discomfort. Now, infants are going to pass gas a lot anyway. That's what they do. They both swallow air when they feed, and the bacteria that are colonizing the intestines are going to digest whatever food is left over in there, and that's going to generate gas as well. So it's not unusual for infants to pass gas frequently and happily, and it probably does make them a little uncomfortable while they're going through it. Some babies seem to cry an awful lot. This is called colic when they have this, and it usually occurs around 6 weeks of age and lasts until 3 months of age and then goes better. These babies certainly do seem to be having abdominal pain, but nobody has really figured out what works to make that better. It's very frustrating for parents and for physicians. Babies who have colic also tend to cry at the same time every day, usually in the evening around 7, 8, 9, or 10 at night. They'll cry continually for 1, 2, or 3 hours, and they're often difficult, if not impossible, to console. We frequently try antacid medicines like ranitidine or Prevacid, and sometimes we also try simethicone drops. A popular brand is Mylicon. It's rare that either of these interventions really work. While some babies may have gastroesophageal reflux making them cry, it's rarely related to colic. We estimate 2 or 3% of the time. Mylicon, while it's very popular and there are a lot of people who swear by it, has in randomized controlled trials never really been shown to do very much. So if you're using Mylicon and it doesn't seem to help, don't feel bad about not using it. Nobody knows that it actually works. You certainly can do some things to help your baby feel better. One is to turn your baby over on his tummy and pat his back. Now, you don't ever want an infant sleeping on his tummy until he's at an age where he can roll himself onto and off of his tummy at will. However, you can hold an awake baby on his tummy, on your chest, or on your arm, or on your lap, and this does seem to make abdominal discomfort better. There are lots of different bottles and nipples that are marketed for gas. Unfortunately, the scientific literature is almost completely silent on whether any of these work. So, as a doctor, I don't know what to recommend, but certainly you can try different bottles and nipples and see if there's one that works for you. Likewise, if your baby is breastfed, you might try taking dairy products or soy out of your diet to see if that has any impact. Sometimes it does, sometimes it doesn't, but it's something to try. If your baby is formula fed, you might want to try a hypoallergenic formula, again to look for possible milk protein allergy. A couple of the best examples of these are Nutramigen, Pregestamil, and Alimentum, all of which have broken down milk protein. You can also try a soy formula, although about half of babies who have a reaction to milk protein will also have a reaction to soy protein. Talking about babies and gas, I'm Dr. David Hill.